I think that there's a lot more kids out there. And again, I know this because some of these kids come and see us without a diagnosis. And the
Wow.
family knows
Yeah.
there's something, but they just don't want that on paper. They don't want their kid
Mm-hmm.
to have that diagnosis. Then you have some families that want the diagnosis so they can get the services from government assistance. And,
Mm-hmm.
so it's hard to look at the numbers, but I will say that I do believe that we're going to see autism rates are going to be skyrocketing, in the next 10 years.
Oof.
And I think you're going to see more of a prevalence into boys, but that female autism rate is also going to start to increase as well. And I've seen it over the last 13 years. I've been in practice 13 years. And, back when I first got started, because I've always treated kids with autism, I've started seeing it was
Hmm.
predominantly boys. Now I'm starting to see a lot more girls than
Right.
than I did in the past. But I think that you're going to see this still high fluctuation of boys, and then the girl population is going to. But plus, we also have better ways to even diagnose, kids as
Mm-hmm.
well. So
Oh man,
it's
why
interesting.
is it more common in boys than girls?
You know, I think that most boys, for example. So if I'm talking from a neuro rehab perspective,
Mm-hmm.
what you're normally seeing is that most alpha men, okay, typically have a strong left frontal lobe. The left frontal lobe is going to be like where you're that man out there that literally is I'm unstoppable. Nothing's going to stop me. That right side of the brain is going to deal more of an emotional aspect. It's going to be a little bit more passive. And the alpha male, what's happening in society is the alpha male is starting to go down. Okay. Now, in
Mm.
saying that, this is why when you see an autistic kid, especially a male, that kid basically has a one track mind. It's, I want this, I'm going to get this, and I'm going to, fight. Or if you take my cell phone away from me, I'm going to attack, or I'm going to go
Yeah.
ahead and have a behavior impulse. And that's because the right frontal lobe, that emotional, the calm side of the brain, it's basically not being able to have enough of neurological connections to inhibit that kid. So I think that that's my personal opinion. The difference with females is that females are typically super nurturing, emotional, which is the right side of the brain. So you don't
Okay.
see as many alpha females as you do more of like women that want to stay home and raise their kids and nurture babies,
Mm-hmm.
stuff like that. So I think the presentation of it's considered
It looks
lateralization
different.
of the brain. There's a great book. It's
Mm-hmm.
a guy named Ian McGilchrist, Master and His Emissary. And all it
Mm-hmm.
does is it talks about the difference between the left frontal lobe and the right frontal lobe in characteristics of personality and in behavior. So in saying that, that's my personal opinion. I think that you're seeing more of a male prevalence because most men, should be left brain dominant, and then most females should be right brain dominant when most autistic characteristic traits are going to be weaknesses of the right frontal
On the
lobe.
right side. Wow. 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 Okay. I have one more question. My last question is about technology, the role of technology in autism.
Yeah.
I've seen kids learn a lot through games and gaming, and I know you're involved with projects to teach kids different things through virtual reality and through gaming and such. But also, we talked about how the increase of technology is actually making kids more